Hi, and a very good evening to all of you. Once again, it's a Friday, and today we are here again at Eclectica. Sorry for a little delay because we just facing some technical glitches. As you know, it always keeps happening. Well, not wasting much time, today I will call my gorgeous guest in very soon, Dr. Malini Manoharan. But before that, let me tell you with whom you will be meeting today and what exactly we will be talking about. So, here is about Dr. Malini. Dr. Malini Manoharan is an innovative and performance driven entrepreneur with a deep passion for science and a vision to accelerate science for life. She is the co founder and director of Deepknomics Labs Pvt Ltd. Deepknomics is a data driven technology company with a mission to building products in the clinical diagnostics and immuno-oncology space, working towards making precision medicine a reality. Dipnomics is also the winner of Startup Karnataka Elevate Grant 2021. Dr. Malini built her initial career in this space, playing several leadership roles in MedGenome Labs, which is one of the leading genome based diagnostic companies in India. She has delivered over 250 projects, built patented algorithms, and published several papers in oncology in collaboration with clients in this role. MedGenome and OncoPept platform of advanced genomics based solutions designed to accelerate cancer immune oncology research was named the winner of 2018 MedTech Breakthrough Awards for Best Overall Genomics Solution. Malini has made a significant contribution to this platform, which is also patented. She is an alumni of the prestigious Indian Institute of Sciences and National Center for Biological Sciences, Bangalore, where she did a couple of postdocs studying the role of kinases in human diseases and analyzing genomes of medicinal plants. She is also an alumni of the Indian Institute of Management, Bangalore, through the prestigious Goldman Sachs 10,000 Women Executive Education Program. She has a dual PhD from Manipal University, India, and Université de la Réunion, France. So I know that you are all excited to meet my guest. So here I take the privilege to call in Dr. Malini right here in the broadcast room. Hi, Malini. Thank you so much. And thank you. I mean, I'm very sorry for the delay that we missed out a little minutes that we are facing some technical glitch, but I really appreciate your patience and, being with me. Thank you so much for accepting my invitation and coming over at Eclectica today.
Yeah, yeah. Thanks, Gargi. I'm really delighted to be here, and I'd be happy to take all the questions that you have. Yeah, it's great to be here.
Sure. Sure, I think already the audience is very already overwhelmed by like the profile you have and the extensive career that you have, your professional achievements. It is extremely inspiring to see such a woman entrepreneur, and I think that's where the first boost of inspiration comes for anybody, particularly women who would be, into the journey or like aspirant entrepreneurs like me. You are the source of inspiration, I must say that. Well, so to all our audience, I think, Malini, this is the right moment, and you are the best person to talk about precision medicine and oncology. So basically, our entire discussion today would be focused on precision medicine and cancer diagnostics. So
Right.
here my goes my first question to you, because that is my duty today to throw questions at you. Yeah. All right.
Yeah.
So Malini, can you explain us in a very simple way what exactly is when we call this precision medicine? What exactly is this?
Okay. So to be precisely, precision medicines is simply the right drug for the right patient at the right time. To expand on this, I think it's important to understand three different things. One is why do we have to look at the genetic makeup of an individual and how it contributes to a lot of things and what role it has to play in different diseases, It can be genetic diseases as well as cancer, like you were mentioning. And the third thing is how this is going to help us improve the treatment regimes that we have for all these diseases as well. So I'm going to break this into these three segments so it's easier for the audience to understand. So let's start with how we are made up of. So we are made up of genetic material, we're made up of DNA, and these DNA code for a lot of proteins which do a lot of functions, starting from how we process food, how we metabolize drugs, how we get rid of infections, so on and so forth. And having said that, this also determines a lot of things about us as an individual. Though all humans are 99% similar, there is 1% difference among all of them that makes us Gargi Gargi and Malini Malini, right? So we look different, our features are different, eye color, hair color, texture, height, and things like that. And the way you metabolize food is different. For instance, take India as an example. North Indians, people who are in the northern part of India, they can process wheat better compared to South Indians who process rice better. So a lot of things are adapted into the genetics as well, and a lot of things are also inherited from our parents through generations, parents, grandparents. You would realize that your kid could suddenly look like a great grandfather, and people would tell you that he looks very much like the great grandfather. And these are things that we adopt from people, right? So there is also important role it plays, uh, where it poses also risks to certain diseases. For instance, lifestyle diseases like diabetes or cardiovascular diseases. These are diseases that are inherited in families. Say, if, my father has a cardiovascular diseases, the risk for me getting the same diseases is very high. So this can be pre-assessed, or we can assess this risk through studying the genetic makeup of an individual. And also it plays an important role in also what we call as a genetic diseases as well. These are diseases, rare genetic diseases. There are about 8,000 different rare genetic diseases, and they are called rare for a reason, because they show up very different symptoms there and impact very less number of people. But however, in a country like India, where there is a lot of consanguinity in marriages, what I mean is, we are used to getting married within the families. We used to get married to uncles and relatives and cousins, and that kind of increases our risks to genetic diseases, or having a child with a genetic disease is very high. And the third aspect is the genetic makeup also determines our risk to cancer. This is And cancer can be you can get cancer in two different ways. Either it can be inherited, or there can be predisposing genes. For example, cancers like endometrial cancer or breast cancer or ovarian cancer. These are cancers that you inherit from your parents. An aunt or a mother, or your mother had it, you are definitely going to have it. So it's recommended that you keep screening and things like that. And there are also other cancers that you can get because of lifestyle habits, or simply to the environment that you're exposed to, right? Say that you're living in a very polluted area, or you are living in a area where there's a lot of chemical exposure, like asbestos for instance. It can cause you what is called mesothelioma. And you smoke lifestyle, the way you eat, you have a sedentary lifestyle, you're not metabolizing your food well, and all this can give you colon cancer. And lung cancers can happen because you're smoking. And in a country like India, you can also get tobacco usage is very high. So the most prevalent cancer is the head and neck cancer. So all this actually changes the way our genetic system is made up of, and it's very important to understand how it has changed, so we are able to go and rectify it properly. So that's what we call it as precision medicine, where we try to identify the exact cause for the genetic disease or the cancer, and we try to rectify the exact cause so it does not replicate in the DNA machinery. So what happens is, when there is a mistake, the mistake is replicated within the body, because every day new cells are made, all cells are destroyed and your DNA is replicating on a regular basis, it's doing a lot of work. There are millions of cells being destroyed and created. And when something goes wrong, it keeps making the mistake again and again. And it's very important that we correct it. So the way we look at and analyze genetic data to understand how it caused the disease, and also how we can actually directly target the causative part of the DNA and rectify the disease, and get rid of the whole disease, is what is called as precision medicine.
I think that was a fantastic and very extensive but very simple way of explaining such a complex topic or complex idea about the science of precision medicine. I think we got a very, very clear idea, and the way you have explained, and right, like as you said, I think it's maybe we can say that this kind of advanced science gives us, a liberty to actually see the typos in DNA. Maybe that is how we actually can conclude on this part. Well,
Yes.
as a healthcare professional myself, well, this would be an obvious question to you, that we are calling this as a precision medicine. So it sounds that it is something different. So how does it differ from traditional or conventional medicine that we have been taught or we have been educated and we actually practice also in the today's
Yeah.
day-to-day healthcare diagnostics? Yeah, I'd really like to know that. Yeah.
Yeah, yeah. So that's a very interesting question, and that's also an immediate challenge as well in terms of adopting precision medicine, because the healthcare system as such is adopted to a symptom-based treatment approach. So clinicians are excellent in terms of identifying. You just go tell them two, three symptoms, they'll be actually be able to write down a few tests and then narrow down on a disease very quickly. So that is still the most abundant approach that is being used. But then what happens is, just look at this in two different examples. One is cancer and one is COVID, for instance. When COVID happened, there were a significant percentage of people who actually could not fight the disease, right? It was the same set of medicines that was prescribed to all the patients.
Right.
But then you would have noticed that some of them could not fight it at all, while some of them could fight it really well. It happened even here, in my family. When we and my friends got, or my friends and people in my family were asymptomatic, but I ended up being very, very symptomatic and I had to be hospitalized and all that. And genetics plays a very important role here. There was something in the genetic makeup able to fight it better, right? So it can genetics actually play a very important role in terms of how we are able to fight a disease, in terms of infectious diseases, and also in terms of how we metabolize certain drugs. Say for lifestyle diseases, for diabetes, you have regular medications that are prescribed. But within a family, my father would process and he would have a normal sugar level, but the same drug, when prescribed to my mom, it doesn't work. So even if you see within a family, one parent will have one set of drugs and the other parent will have another set of drugs. Currently, this is being done based on a trial and error method. So they give you a drug. They say come back with the blood test report after 2 months or 3 months, and then you go back and they change the medicine, right? So that's how the traditional way of medication works. And the third example is cancer, for example. Mm. So in cancer, the major treatment approaches that are currently used is surgery, radiotherapy, and chemotherapy, right? So surgery is still the best way, where you're able to get rid of an organ. For instance, it can happen in certain organs, like, you can get rid of your uterus, you can get rid of a breast, all that can happen. But then when it actually metastasizes and there is a lot of metastasis happening, you're in a fourth stage of cancer, that's not it cannot be done. The surgery cannot work. And what happens in radiotherapy and chemotherapy is, and also the mischievous character of cancer is they look like normal cells, right? So it's very difficult to identify a cancer cell from a normal cell. So what happens in radiotherapy and chemotherapy is, you intend to kill the cancer cells, what you do is also kill all the normal cells around the cancer cells, which is why you see a lot of side effects in these kind of treatment approaches in cancer. So, all these things that I described to you can actually be taken care of by uh, precision medicine. For instance, if I knew earlier that I had a higher risk of, being a very highly symptomatic patient for COVID-19, I would have never stepped out of my house, right?
Right,
So,
right,
and even for instance, like, if I knew I have a higher risk of cardiovascular diseases, I would think twice before I, pick up a smoke, right?
right.
These things can be very different. And then in terms of lifestyle medicine, I don't have to go through the trial and error. So I will have with precision medicines, what you can do is you can take a card and say you're allergic to these medications. So this can be done now with the advancements that have been happening. So you can take a card, a ID card sort of thing, a prescription card, and tell your doctor that these are the things that will be difficult for me to metabolize. This drug is going to stay in my body for a longer time. So please give me some other alternative. And the doctor can also get a lot of information on how the different drugs interact, and how it's going to affect the patient, and so on and so forth. So this is called pharmacogenetics, and it's becoming very, very important in terms of in a hospital setup as well. And cancer, for example, is the most interesting disease where precision medicine can play a very great role, because what happens is when you get cancer, you're abused with chemotherapy, radiotherapy, and n number of drugs that are available. So what happens is they give you a drug, they wait for 3 months, you don't respond, you wait for another 3 months with another drug. But the problem with cancer is you gave it 3 months time giving the wrong drug, so it has replicated and did all its mischief, and it's metasized, it's going and impacting all the other organs. So it's the time is very important in diseases like cancer, and I think precision medicine has a very great role there. And what is also becoming very famous is immunotherapy, where we will try to trigger the body's immune response to the cancer neoantigens. Thanks to COVID, now everybody understands what is antigen, what is
Correct.
antibody. It's easier for me
PCR.
to yeah. So we also have, like, we tested the antigens in the PCR test. The antigens of cancers also can be determined, and we can design neoepitopes that can be injected back into the patient, and and can be treated by their own immune system. I think that's the best approach to get rid of a cancer also. And they are also developing another area which is called the CAR T cells, where they will design specific antibodies for cancer antigens that can be used by the patients to get rid of their own cancer. I think this is a major difference. It's a time factor. It gives you a lot of time in terms of, it expedites the treatment approach very precisely. And in very interestingly in cancer, because the same cancer can be very different in two different individuals, right? So you can't use the same approach for both of them. What works in one may not work in one at all, even if they are from the same family also. So I think there it plays a very major role compared to traditional or conventional medicines.
Thank you. I think it's an eye opener from you, and it's so fascinating to understand that where technology has gone today. And well, just on a kidding part, thanks to COVID, that now molecular diagnostics has just gone inside every
Everyone's
every
house.
home. Yeah, so everybody knows what is PCR, RT-PCR. That's a positive part, I should say. But no, God forbid, we should never get a pandemic again. Yeah.
Right.
So, Malini, one question that has been hovering, and I have been, reading about it, and I see quite a lot of articles and I just wanted to know that whether this information is really true. That is it true that cancer can be diagnosed at an early stage using precision medicine?
Yeah. It is true, because what you're doing in precision medicines, you are looking at the genetic composition very early. So you also are now, you will be also able to understand predisposition. Predisposition is, there are some cancers like the colorectal cancer. There is a cancer called Lynch syndrome that can be inherited from the family, and this can be, you'll be able to diagnose your risk with one particular mutation. So we can look at your DNA. If there is that mutation, it means that you are at an increased risk of getting this cancer at a later stage in your life, say 40 or 45. And then you can optimize your lifestyle, so that you do not get that disease. And also, it is very important for cancers to be diagnosed at an early stage. And when it is presented as a symptom, it's very important that we identify the right cause of that particular cancer, so we can get rid of it when the number of cells are very less, right? So we will be, as it is true, we will definitely be able to do an early diagnosis with the help of genetics. Yes.
That's fascinating, and thank you for that validation of this fact. And I think it's wonderful that we are so ahead in time with science, and particularly in when it comes to cancer diagnostics. Well, in this context, I would like to understand, like as you already said, still we are into more belief. I believe maybe this might be a little. What to say, very direct statement, but then I would like to do that, though I am also a healthcare professional, what do you think, what is how much we have reached through adoption? Because I think knowledge about this precision medicine, like you are coming from an expert domain. So when a healthcare professional is educated formally, at least I will talk in terms of Indian education system, we though
Yeah.
there are parts which are just mentioned in syllabus, it is never taught formally. So
Ex-
always there is an existing gap. So just to understand from you as an expert, that how much do you think this adoption in terms of precision medicine as a tool, such a powerful tool it is, what is your opinion regarding this? How much adoption has happened, or where we are actually at this point?
Yeah, you're actually partly true. You also partly answered my question that the healthcare system right now is adopted, like I mentioned earlier, too, is adopted to a symptom-based treatment. And though it's in the syllabus, the way the genetics is there, they don't go into very in depth on understanding that. And also, I understand that it's very difficult for doctors to also adopt to so much of research flood that is happening. People, there are research labs working on one particular disease day in and day out for
Right.
365 days a year, for getting a Nobel Prize, and but they are targeted to treating one particular disease. But for a clinician, it's not that, right? So
Correct.
every day he's seeing hundreds of patients, and it's important for him to not waste a lot of time with a lot of patients, because he has a lot more work to do. And then that's it's amazing that I appreciate clinicians for that. But then it's not very far, I would say. The second thing that was actually a hindrance was the cost of this testing as well.
Right.
Earlier, it was really very good, but what we're looking at in the next couple of years is a very cheaper approach for genetic testing. So, if you're not aware, genetic testing is going to cost you just about $100 or $200 in the near future, probably in the next couple of years. So all of us can have our genetics analyzed, and we can have it on our phones. There are technologies that are being developed. One of our clients and is working on a technology where you can put the entire genetic profile into the phone, keep it in your
Wow.
phone, and then carry it to your doctor every time you want to go, right? So the cost is taken care of. The second part, the clinicians, to adaptation of clinicians, I think there has to be some bridge between the research environment and the clinicians, right? There must
Right.
be someone in the middle actually playing this role of connecting the clinicians, make it easy for them, make it available to them, so that they don't have to spend a lot of time reading or trying to explore a huge database, and getting
Correct.
lost in that database, and trying to get the optimal way of the few minutes that he has with his patients. I think if that is done, it will get adopted very soon. We are not looking at a 20-year or a 30-year. I think in the next 10 years, there'll be a rapid adoption of precision medicines for sure, because the major factor is going to be the cost. And when a genetic testing is available, people want to take it, and it also pushes the clinicians to get into it as well, right? Yeah.
Absolutely, absolutely. Because certain things that we keep seeing, and people like you and like me who are enthusiastic about genetics, we keep seeing things like, if we are enthusiastic about knowing our ancestry, I think knowing about our risk to certain lifestyle diseases or cancer would be more valuable information, and we can use this technology to our own benefit, actually. Yeah. So,
Yes.
Dr. Malini, just that I know you, and you have co-founded Deepknomics Labs Private Limited. So I'll be very interested, and all my audience are also interested to know about your organization. So can you please tell us more about your organization?
Yeah. Actually, the previous question that you asked was very relevant, and it kind of paved way for me to explain what exactly we do. So,
Great.
as I mentioned earlier, there is a huge gap of what is happening in the research environment, and what is in what the clinicians are trained to do. And we what Deepknomics is actually trying to do is bridge this gap. So what we are doing is we are building products and solutions that a clinician can adopt in the clinical environment. We are building mobile applications that he can use within the less amount of time that he has with his patients to get to a diagnosis of a rare genetic disease. And we also try to give him a very detailed cancer therapeutic recommendation report, from which he would be able to understand how this particular patient is going to is there a targeted FDA approved drug for this patient? Can this patient be given chemotherapy? And
Oh,
in chemotherapy, you have different chemicals and different
right.
prescriptions that are there, and how his genetic makers is going to take this chemotherapy. Is he going to have a very adverse side effect to one sort of a prescription? So the doctor can choose another one. And we also give information of any clinical trials that are going on, where the patient can enroll himself. So this is one of our services where we give the clinician a detailed cancer therapeutic recommendation report. And we also have something called the pharmacogenetics report, which I also explained earlier, where we give you a card sort of thing, which you can tell you what sort of drugs you'll be able to metabolize better, what will work for you better, what antidepressant can you take, what antipsychotic you can take, or what you should take, what you should not take, what can kill you also. A drug can also kill you, right? You can have really adverse side effect and you can get killed. So we give this in this report as well. This is also one of our reporting services. So these are services that we give to hospitals and diagnostic centers. And we also give rare genetic disease analysis as well. We do a variant diagnosis of rare genetic diseases. And the Startup Karnataka Elevate program has funded us to build a product called Deep Diagnose, where we are trying to help the clinician build identify rare genetic diseases very quickly based on the symptoms that he's seeing in his patient. So we're working on building that product, and we're also doing another product called heme typer, which can give you a very extensive information on your blood groups, right? So we traditionally know that you're A positive, B positive, O positive. But when you have diseases like sickle cell anemia or thalassemia, you're in need of frequent transfusions, blood transfusions, or you have to have a transplantations, you have a lung failure or a kidney failure. So that time, even if you're in the same blood group, you'll have to also look at other parameters. Extensive blood typing is something that we also have. So these are some of our products and solutions. And apart from that, we are a bootstrap company very proudly. So we bootstrap through service projects. We work with researchers. We help them with their research. We do data analysis for pharma companies. We do data analysis for research institutions as well. So as I mentioned, we work with researchers also and clinicians also, and we put ourselves in the middle because the vision of the company is to accelerate science for life, which is also my vision. So I think that's the best way, when you put yourselves between two different strong environments. Uh, you'll be able to do that. So that's what we do in Deepknomics.
This is amazing to know. And just that, Malini, if anybody want to go and check your services that you have mentioned or the products that you have mentioned, so can you tell us your website or the resource where they can find this information?
Yeah, so our website is www.deepknomics.com. They
Okay,
can visit our website, or they can also reach out to us at any time. It's just Malini at Deepknomics, and I have two co-founders, Dr. Rohit Gupta and Dr. Swapnil Mahajan. So they can reach out to them also anytime.
great. Great. I think once our session is over, this live session is over, I will also put all this information in the description of this
Sure.
video. So I think
Yeah.
if anybody wants, they can just take a look and they can reach out. And well, to now this is a message to my audience. I got so engrossed in this conversation that I really want to thank you for your time, and you have joined this session. And I see a lot of people who have joined in the live, and if you are here, just encourage our conversation, give us some boost of energy, because we are also spending a lot of energy talking and sharing knowledge. So I'd really appreciate if you're here and you want to mark your presence and let us know, then just write in the comments who you are and from where you are. That just elevates our energy. Well, so we are almost at the concluding part of our conversation, Malini. So a very interesting question which is running when you have been talking about all this, you have explaining this precision medicine. What I understand, that this is an extremely powerful tool, and since today we are just focused on cancer diagnostics, so my next question is that how do you as an expert see the future of cancer diagnosis in terms of rapid advancement in molecular technologies?
Mm. So as I mentioned earlier, now it's very the cost has come down very drastically. So it's going to it's going to just be as similar to a CT scan that you would get done, right? It's about 6,000 to 8,000 rupees. And there are insurance companies also adopting to genetic testing, so you'll be covered by the insurance. And I think this is a big move, and I'm really
Right.
happy. This is just happening this year. The drastic reduction in cost to $100 genome is an amazing improvement, or the boost in the molecular technologies actually. So I think so there is going to be an explosion of data, which means that we are going to be able to understand different cancers much more than we actually do today, which is going to be very useful. It's going to be a new era in terms of a cancer world for starting now with the data explosion.
Yeah. So, so by the way, to all our audience, if you have any questions, please feel free to post in the comments so that Malini will be able to answer them after just concluding our conversation. Well, so this is one question which I asked to all entrepreneurs, just to understand what was their mindset when they stepped into this sea of challenges. So, what inspired you? Because what I understood from your profile, you have been an avid academician, I mean fantastic academician. So what inspired you to enter entrepreneurship, and how is your journey till now?
Yeah. So you are right. I'm a very passionate scientist. I love science. It's just very interesting for me, and I always need a scientific problem to solve. To be honest, it keeps me very alive. But then what I realized is there is a lot of things going on in the scientific research, but nothing is reaching the actual purpose, right? So that's why we wanted to have build something that will actually translate all of this to
Hmm.
the bedside environment.
Right.
And I think and being an entrepreneur is also a continuous learning process, and that's something that I miss from my childhood. I know a lot of my friends and will laugh at me, but exams and challenges are something that I miss. So I
Mm-hmm.
think as an entrepreneur, I am getting back all that fun. It's
Correct.
a lot of challenge every day, and every day it's a new challenge, because it's a new requirement altogether, and it's very exciting. Every day is very exciting because you have something very interesting to solve, and I think that's the motivation that I have. And also, uh, getting into an entrepreneur is also about the rest of the people in the team, right? So you can being a solo entrepreneur is going to be a very difficult journey, and I think I also had excellent people that I could work with, and that's also a motivation to why I had moved into. My two co-founders, Dr. Rohit Gupta was my mentor. He was I was reporting to him in my previous role, so he's an excellent mentor. And the other co-founder, Dr. Swapnil Mahajan, has been my friend for more than 15 years now. And both of
Wow.
them are excellent people to work with in terms of the attitude they carry, and also the technical diversity that we have. We kind of complement each other in terms of all the skills. And I think it's a very great team to work with as well. And I think as an entrepreneur, that is also a motivation for me to take up this journey as well. Yeah.
That is amazing. That is amazing. I mean, pulling a company out with your friend and your mentor. Nothing can be best than this. I think touch wood, you are very very lucky. Very few people would be so lucky like you. And I wish you very all the best for whatever you do. And just a very beautiful comment from Tami Selvi M. This Tami Selvi says that really beautifully explained about precision medicine. Thanks, Dr. Malini and Dr. Gagi. Thank you so much for that sweet comment. And well, Malini, just the last question of this show today to you.
Mhm.
That what would be your message to the world for achieving a cancer-free world, if we can really dream of a cancer-free world? Yeah.
Okay, so that's a very hard-fetched target. The kind of environment that we are living in a very fast-paced, technology-based environment. I think earlier, when long way back, our grandparents or parents had a much better life, to be honest. But then it's again very interesting era to be in, because especially our generation, right? So we are amidst a huge technological transformation that is
Exactly.
happening. Our kids don't understand, but we understand that we are stuck between parents and the kids who are very technological advanced, and parents who are very technologically not that advanced. And I think cancer free world is it's going to be a bit hard now, but then what you can do as an individual is try to avoid a sedentary life. I think that's very very important. Try not to abuse your body with food. You have to give the body the respect that it needs, because it's a machinery. So I think it's very important that we respect this machinery and be very cautious about what we are putting into it. I think that really matters. Give enough time intervals. The way you eat is also very important. How much you chew is important. You'll be surprised that all of this actually plays a very major role. And there are a lot of pesticides that we are getting exposed to. But I think it's very important to keep your body very balanced. Have a healthy lifespan, go for a walk, do yoga, and avoid smoking. I mean, that's the to give you this information. One cigarette can actually cause you about 50 mutations, and you don't want even one of them to go wrong, right? So, and what happens is you are also impacting other people around you. I think that is why head and neck cancer is very prominent in India. Of course, avoiding smoking and tobacco is also very important. A small changes in lifestyle that can be easily adopted, if you're willing, will actually keep you away from cancer. But even if you get cancer, I can tell you we've got your back. It's
Great.
going. It's not in the next few years, 10 years or 15 years. Cancer is going to be just like diabetes, it's going to be treatable. There will be ways to get treated with the thanks to all this advances in molecular biology as well as in data analysis. You have artificial intelligence coming up. We are able to understand data better. We are able to build things better. So yeah, it will be taken care, but personally also it is important that we take care.
Absolutely. That was a
Prevention
wonderful
is always
message.
better than cure. Yeah.
Here. And thanks to you for mentioning that one cigarette causes 50 mutations, because right now I will please allow me to use this as a tagline, because particularly dental professionals, I think from the day one we enter dentistry, learning dentistry or specializing in it, everybody, we try to talk about like bad uses of tobacco, and we do a lot of programs in tobacco intervention. And well, but still we are not very successful. But I think I will now use this power of genetics and take your tagline, quoting you obviously, that one cigarette causes 50 mutations. And thank you so much, Malini. I mean, this was wonderful meeting you. And we have a very sweet message from Aparna M. Malini ma'am is really a great inspiration to all of us. Keep going. Yes, I absolutely agree with you, Aparna. She's a real inspiration. Thank you so much, Malini. In spite of your busy schedule, you have given me a lot of time and you have inspired all our audience. Thank you so much.
Thanks, Ragi. It was great being there on your show. Thanks a lot.
Thank you.
Yeah. Thank you.